So here we start the session called Embryo Genetics. So this is one of my presentation, which I have done in one of my conference in September 2021. So I didn't change the date. So fine. Embryo genetics is very important because everything, all your complete embryology, the basic thing is the embryo genetics, which is very important. Now, when we talk about the embryo genetics, obviously the embryos are formed by the egg and sperm. So we'll be discussing about both the parameter, which plays a very important role to make sure that the genetic of embryos should have been turned into good quality, which we call it as an aneuploid embryo that we consider for the embryo transfer. Okay. Any defects in the genetic arrangement in the embryos that obviously result into many different negative parameters. It can result into miscarriages in the early pregnancy, or it can result into an abnormal baby. All the embryologists aim is to make sure that the embryos which are created from their hand should result into a healthy baby. So this is what all the embryologists aim. But there are certain challenges even embryologists will face in order to justify this thing. The challenges are multiple. Say, for example, when I started my career, miscarriages and all, it's like very rarely we used to hear this word called miscarriages or abnormal babies. But nowadays, in this past 10 years, there are a lot of genetical changes, which we call as mutations, which has happened in the fertility society. The best example is, say, for example, our grandparents-in-law, or even our parents, they used to have at least 5 to 6 siblings at home. So that is what called as a family. But now in this present generation, couples are struggling to have a one baby. So if we have one baby in the family, then we call that as a family now. In olden days, at least a family used to have a minimum of 6 to 12 siblings. So why this drastic changes over the period of consider maybe 50 or 60 years? There are a lot of mutations that's happening. Of course, our lifestyle, the food we take, and external and internal parameters, which all put together cause this mutation. And mutation, we know that it not just happen like that. It takes years together. How we, as a human, how we evolved from a ape. Mutations will causes slowly it takes its own time to show its face. So that's what happened in this past 40 to 50 years. So now the mutation in infertility is so high that before the worldwide infertility ratio is hardly 30 to 40%. But now it has become 50 to 55%, almost half of it. Another down the line, another 30 to 40 years, there is no wonder that any couples who wants to get pregnancy, they may have to visit a fertility clinic and then register themselves for an IVF procedure. Because nobody down the line, nobody thought 50 years back that to have a baby, we have to go for an IVF procedure. But we have come to this level. Now, over down the line, again, another 50 years, we don't know where we will be. Okay? Again, this is all a debatable topic. But yes, mutations are the one major causes for an infertility. Okay? Now, the genetic abnormalities can be caused either by the sperm or the oocyte, or the combination of two, which we call as a zygote, or even the embryos. So in this session, we'll be discussing about what does the sperm, how does it play its important role when it comes to genetic, and how the oocyte will show its genetical parameters. Okay. Coming to the sperm morphology, we have 2010 edition and 2020 edition, which is what we are following it recently. This is from the WHO. Morphology plays a very important role. Obviously, there is no doubt. When we do an ICSI procedure, especially in an ICSI procedure, or let us come back to the ICSI later. Let me start with the basic. When a couple comes to a clinic for an infertility treatment, what basically we look into is what's the husband parameter with respect to the fertility things are concerned. So we do a fertility check for husband and a fertility check for a wife. When it comes to a fertility check for an husband, the sperm parameter, the seminograph plays a very important role. In that, the primary tests like the sperm count, the morphology, the motility are very important parameter which we look into. When it comes to the sperm morphology, in case if anything lesser than the recommended value, the probably the defected sperm, in case that could have been there is an increased chance of that defected sperm fertilizing the ovum. Because of that, maybe any issue with miscarriages or infertility issue. So we make sure that the morphology is normal, the count is normal, and the motility is like in a normal range. So when now parameters are normal, all these three parameters are normal in a couple, but still they're not able to get pregnant. Again, we look into the wife parameter, like what are the fallopian tube, whether the hormone levels are normal, whether she's in PCO, whether uterus is normal, whether she's ovulation is happening properly. So there are n number of causes when it comes to the female part is concerned. When it male part is concerned, what mainly we look into is the sperm parameter. So imagine that both the parameters are normal, husband and wife parameters are normal. Then this we call it call as an unexplained infertility, because all the parameters are being normal, but still they're not able to get pregnant. But in science, there is nothing called unexplainable. There are some explanation which is there. So that is what the ART is dealing with, the assisted reproductive technologies deal with. So when we consider a patient comes for an infertility treatment, we make sure that we go in detail and analyze what is the particular cause which is causing the the infertility. When we do a semen analysis, we check mainly this parameters which you are seeing in the screen. Any defects here, we treat them and make sure that we get normalize this thing with respect to patient. But again, all the patient may not be treated when it is like, say for example, when there is an azoospermic condition, it's very difficult to treat them and get the sperm into a normal count with respect to the normal semen analysis things are concerned. We have certain procedures like a PISA testicular biopsy where we can retrieve the sperm in case it is an obstructive azoospermic. Yes, apart from all these things, we got some morphology. Okay? Now, how the morphologies says the genetic of the embryos is that our main concerns today. There are some papers and evidence says that the sperm which has a now when we come to the sperm head, the left side what you're seeing is the normal sperm where it has an oval shaped head, and this is the mitochondrial region which we call it as midpiece, and followed by a tail. So this is called a normal sperm, and more importantly, the apex of the sperm will have an acrosome region where the hyaluron activities will be very much higher. So this is what a normal sperm parameter, sperm morphology. But on your right side, we can see there are a lot of abnormalities, and the abnormalities are categorized into different head defect, midpiece defect, and the tail defect. So any sperm which is having this kind of defect which you are seeing on the right side, we will not select this sperm because it indicates that the genetic of that particular sperm may not be good. I mentioned may not be. It is not 100% sure that it is good or bad. Generally may not be good. Why I'm saying this? Because there is a procedure called a PIXI procedure, which I'll come later. In that procedure, the principle of the PIXI procedure is we have an hyaluron bonding assay. Principle says that when the head bond its head, when the sperm bonds its head to a medium, where the head will be attached and the tail will be wobbling. So this says that the genetic content of the sperm is good. Obviously, 90% of the sperm we have a normal shaped sperm, but sometimes I have seen even the abnormal shaped sperm do this reaction, hyaluron binding assay. So that says that again, it's not like 100% theory, but yes, there is in PIXI there is a high chance that you can take a good normal sperm Because the main principle is only the good sperm, the sperm which is having a very good DNA will go and attach. So even the abnormal sperm, I have seen this head getting attached to it. Okay, so that is again the other debatable topic. When it comes to Pixie, we'll discuss that. So now, yes, morphology plays a very important to make sure that we select a sperm based on morphology, which in turn says that the genetic content of the sperm will be good. That is, the DNA of the sperm is good.